Hey everybody, welcome to Studio 64. My name's David. I've been searching the interzones for more science, space and tech news to share with you. Came across this at rt.com from the, well, this should be interesting to see where this goes department. UNICEF launches emergency tender for Mpox vaccines. Up to 12 million doses are expected by 2025, depending on production capacity to combat the disease. Yes, I wonder what diseases we'll come up with next that we need a vaccine for. The United Nations Children's Fund, or UNICEF, has initiated an emergency tender to procure Mpox, formerly known as monkeypox, vaccines for the worst affected countries. It follows the recent surge in cases of the viral illness across multiple African nations, which led the World Health Organization, or the WHO, I prefer the original from the 60s myself, but still, to declare Mpox a public health emergency of international concern, similar to how it approached COVID-19 in 2020. Yes. Funny about that, isn't it? UNICEF, in partnership with the Gavi Vaccine Alliance, Africa Centers for Disease Control and Prevention, Africa CDC, the Pan-American Health Organization, the WHO, and other partners made the announcement in a joint statement on Saturday. It highlighted that, depending on manufacturers' production capacities, agreements could be made for up to 12 million doses through 2025. The WHO was in the process of reviewing information provided by vaccine manufacturers on August 23, with the evaluation for emergency use listing expected to be finalised by mid-September. Addressing the current Mpox vaccine shortage and delivering vaccines to communities who need them now is of paramount importance, Leila Pakala, director of UNICEF's Supply Division, stated. Mid-September. I wouldn't be surprised if it happened if they made a major announcement in October. Africa CDC Director General Dr. Jean Kaseya echoed the urgency of the situation, emphasising that timely vaccine procurement and distribution are vital for protecting vulnerable populations in the hardest hit regions. Now, WHO Director General Tedros Ghebreyesus also addressed the situation during a recent briefing, expressing confidence that the outbreak can be contained with coordinated efforts. With the government's leadership and close cooperation between partners, we believe we can stop these outbreaks in the next 6 months, Ghebreyesus stated. Now, Mpox was first identified as a distinct illness in 1958 among laboratory monkeys in Denmark, while the first documented cases in humans were recorded in 1970 in the Democratic Republic of Congo, Liberia and Sierra Leone, where it began spreading rapidly in late 2022. The WHO declared an emergency and renamed the disease Mpox to avoid racist and stigmatizing language. See, that's rather interesting to me. Nobody thought that it would be racist and stigmatizing until it was pointed out that it could be racist and stigmatizing. Fascinating, that, isn't it? Oh, God. The WHO has reported more than 18,000 cases of Mpox and 629 deaths so far this year in the Democratic Republic of Congo. Looks like Dr. Congo to me. Sounds like a bad movie from the 50s or something, doesn't it? However, many of these cases are still classified as suspected, pending laboratory confirmation, according to WHO's spokesperson, Dr. Margaret Harris. Now, according to the Africa Centers for Disease Control and Prevention, Africa CDC, in 2024, approximately 2,863 confirmed cases and 517 deaths from the disease have occurred across 12 African countries, including previously unaffected nations like Burundi, Kenya, Rwanda, and Uganda. Yeah, I'm not an immunologist myself, but if there are any immunologists watching this video, I'd love to hear your comment on it. It's rather disturbing, and here in the state of New South Wales, here in Australia, we had one case of monkeypox from the 3rd of January till I think it was the 31st of July. And then from the 1st of August till now, I haven't got an updated figure in the last few weeks, another 93 cases. 94 cases, of which 93, think about that, 94 cases of which 93 have occurred in August and the start of September. So basically a month. How is this spreading so quickly? This is really interesting to me. Fascinating, isn't it? Love to hear your thoughts on this down below. I know it's a terrible illness and I wouldn't want anyone to get it, of course, but it just fascinates me, the reaction to it. Sounds awfully familiar. All right, well, my name is David. Thanks for joining me for another Studio 64 Science, Space and Tech News update. I shall see you in the next one. If you enjoyed this video, please like, share, subscribe. I'd greatly appreciate it. And if you're up for it, drop a comment down below the video because I'd love to hear what you think. Well, take care, and as I always say, if you can't be good at it. And as I also always say...
Did IQs just drop sharply while I was away?
5, 4, 3, 2, 1, fire!